going to talk to you about my project. The purpose of this project was to determine if patient education decreases hospital readmissions of congestive heart failure. There are several reasons why this is significant in nursing right now. Number one, nurses provide a lot of education for patients in the hospital, and we need to have the proper education to give patients the knowledge, the skills, and the rationale for compliance to help them manage their heart failure when they go home and hopefully increase their quality of life and decrease the risk of coming back into the hospital with another exacerbation. The second reason why this is significant in nursing is because we know that hospitals are cut reimbursement from Medicare based on readmission rates with the Hospital Readmissions Reduction Program, and in 2014 they released Phase 3, which adds up to a 3% penalty for readmissions. If anyone's read the newspaper lately, you might have seen that both of the two major hospitals here in the Lehigh Valley were both penalized for their high readmission rates. So that is significant as well. And number three, with all of these things combined, what's the best education? How do we make our patients comply? And how do we reduce readmissions so that we get our reimbursements? A lot of nursing research should really be done to determine all of these things. My literature search, I used EBSCO, CINAHL, PubMed, American Heart Association, National Guideline Clearinghouse, and Cochrane Database. I picked 3 different studies based on the validity of the tools used and the results. The first one, they were able to reduce readmissions with their intervention group compared to the control group. There was a significance of rating of 0.03% with a weight management intervention. 2 tools were used to assess for weight management compliance and activities of daily living. And they had a rigorous telephone follow-up system, which was once a week for the first month and once a month for the 5 months after that. So I would utilize the weight management intervention and the telephone follow-up system, and as well as the 2 questionnaires for weight management and activities of daily living. The second one was done in Florida, which we know has a high CHF population because of all the snowbirds. The goal was to decrease readmissions by 5% in a 5-month period during the winter when a lot of patients come down to Florida. And they were able to reduce it by 8.5%, which exceeded their goal, with one-on-one education from a nurse practitioner and a 7-day follow-up phone call. What they utilized was the American Heart Association guidelines, which is the what we normally teach our patients: weight management, diet, fluid intake, checking for edema, and when to call the doctor. And they also used the heart failure zone map, which is green, yellow, red, and describes the symptoms in each of them and also when to call the doctor. And I would use that one-on-one education for at least an hour, whether it is 4 sessions of 15 minutes or 2 of 30 minutes or 1 long session. It might depend on the patient's acuity and willingness to participate. And the third one used the teach-back method. Now, the teach-back method, if you're not familiar, is a way to assess patients' knowledge retention. What it allows for is you would ask your patient 4 questions and you would document their answers. There was no control group for this study because teach-back was already utilized and they weren't going to take it away from some patients just to do the study. But what they found was that 84.4% of the patients were able to answer all 4 questions correctly in the hospital. And I think about 77% of them answered all 4 questions correctly at the 7-day telephone follow-up. So I would utilize that teach-back because they were able to enhance the knowledge. And I think combined with the rigorous telephone follow-up and using those 4 questions every time you would call for follow-up would be a good idea. So I think those are the things that I would put together from each piece to hopefully reduce our readmissions of heart failure and increase the quality of life for the patients that we take care of. If you have any questions, let me know. Thanks.